Doctors, what is your craziest story where a patient presents with mild symptoms thinking it was nothing, and it turned out to be a serious life or death situation? Patient's wife called. Patient had a temperature of 98.6. No other symptoms. I explained it was a normal temperature, but the wife said, "That's a fever for him." She said she felt like something was wrong despite no other symptoms. I told her I respect it, and that if she feels something is wrong, she should get him checked out in the ER. ER docs called 4 hours later, saying they did all they could for him, but he died of sepsis. He appeared normal when he got there, but rapidly declined. That gave me a new appreciation that we can't truly evaluate someone thoroughly over telephone. Next story. I'm a nurse, not a doctor, but we had a guy come in years ago asking for a medication to, quote, help him stop sweating. He said he had a sore throat for about a week, went to a walk-in clinic, was diagnosed with strep and put on antibiotics, but he was so sweaty and just wanted a break from it. He looked pale and was indeed sweaty, so we took him back and ran some blood tests. His white blood count was the highest I've ever seen, and he was diagnosed with leukemia. We sent him to another hospital for immediate treatment. We were informed he died literally hours after arriving. Incredibly sad. I couldn't believe it. Oh, okay, so I'm getting the vibe now. I'm going to leave this thread terrified, aren't I? This is going to be the WebMD of threads where every little symptom is life-threatening. Oh boy. Next story. Saw a patient with minor cardiovascular symptoms and a slight pain in his upper back. The senior debated back and forth whether it would make sense to run a CT to rule out anything more serious. She finally decided to do it, and it turned out he had a massive aortic dissection and was basically wheeled right into the OR. Next story. I'm a dentist. New patient came in with what he thought was a mild ache in his teeth. Thought it was a toothache. Hadn't seen a dentist in years. Took a radiograph and the jawbone around the teeth looked strange. Had him see an oral surgeon that day. Turned out it was a very aggressive metastatic bone cancer, and he died a few weeks later. Next story. My dad woke up with severe back pain one morning after not doing anything strenuous the days or weeks leading up to it. My mom flipped her crap and finally put her foot down that he had to go to the doctor after him putting it off for years, even for a routine checkup. That appointment showed a broken rib from a huge tumor on his spine, along with tumors around his buttocks, pelvis, and upper back. Diagnosed with stage 4 lung cancer. 5 years and 100 treatments later, he's still kicking it. Next story. Still in school, and I wasn't present for this patient's initial admission, but rather her clinic follow-up. However, patient was healthy, 50-something-year-old who had an extended nosebleed after a long hike. It wouldn't stop, so they went to the ER to get it cauterized or impacted. Happens all the time. Anyway, they did a CT scan as protocol and discovered she had a 20-plus centimeter tumor on her uterus that was wrapping around her right kidney. She was immediately referred to a serious academic hospital and had a specialized oncology surgeon remove it. Amazingly, they got it completely removed without even having to damage the kidney. She had an amazing outcome and about a half-foot of scar running around her abdomen from the surgery. Edit for clarification. I don't believe the CT scan was due to the nosebleed itself, but rather, I imagine as they looked further into her blood work and coagulation studies, they found something that warranted further workup. Next story. Not a doctor, but worked as a security supervisor at a hospital. Man and his wife came in. Man is feeling unwell, thinking he has a flu or a cold or something, I can't remember what. Nothing serious, but they don't have a family doctor, so they came to the ER. Man gets in line for triage and his wife leaves to go park the car after dropping him off. I'm not a doctor, but how it was explained to me was part of this man's digestive tract just exploded. He sits down and within 30 seconds, he's slouched over and dead. My guards respond, realizing he's not breathing, pull him onto the floor and start doing compressions. EMS and nurses quickly join us from the back and rush him to a triage room, but whatever happened wasn't recoverable. Wife got back into the ER just expecting him to be hanging out in line. Instead is met with my guards telling her husband is dead in the back, with staff trying to bring him back. I can't even imagine how that is from the wife's perspective. She leaves with her husband basically fine, wasn't gone for more than 5 minutes, comes back, and he's just gone. I was on break at the time and missed the situation, but had to come back and deal with some shell-shocked guards. Next story. Mom was constantly in and out of doctors' offices and ERs for many things, such as extremely tired, extreme weight gain, periods lasting months, and a bad case of dehydration. Finally, an ER doc took notice and sent her for a CT scan and found a grapefruit-sized tumor in her vena cava, later diagnosed with stage 4 leiomyosarcoma. Gave her a few weeks to live, but she battled for about 5 more years. Okay, mild symptoms is not exactly what I would consider this. Like bad case of dehydration and apparently periods lasting months? That sounds pretty serious to me, but hey, I'm not a doctor. Anyway, a lot of tumor talk in this thread so far. Oh boy. Next story. Not a doctor and not my story. Something I read on a similar post a ways back. An ER doc was running some baby docs through training when a disheveled man in an old, rumpled suit, obviously homeless, came in complaining of non-specific malaise, kept mumbling about quantum whatever under his breath. Wasn't all there mentally. She thought he was drug-seeking, but opted to run him through basic diagnostics to show the baby docs how it was done. Turns out the dude was in full-blown kidney failure. They put him on dialysis and he just snaps into focus. Complete turnaround, 100% coherent. Turns out dude was an actual professor and expert on quantum mechanics and was riding a train to a conference when he entered kidney failure. It addled his brain and he wandered off the train at a random stop in a state of confusion. He had been roaming the streets for months like that. Somehow didn't die. Crazy. Next story. Many years ago when I was in my residence, a man entered the ER with a hand on his forehead, walking by himself asking for a doctor. You can imagine my surprise when I said yes to him, and him removing his hand and showing an injury, a perforating hole from a bullet. He was quickly moved to surgery after that. Later I found out the bullet didn't reach the brain. It was well buried in the skull bone. Next story. Probably not particularly crazy. It might happen all the time for all I know. Not a doctor, but I went into urgent care thinking I had a nasty UTI, but it turned out to be severe sepsis. Got whisked away in an ambulance on oxygen. That's what I get for my mom teaching me it's all in my head. Next story. I was the patient. My mom kept bringing me to the doctor because I was continuously complaining of tummy pain. I had just started school. The doctor said I was likely just trying to get out of school and stay home with my mom. I complained the whole school year. She even brought me to the ER a few times and they essentially said the same thing. They never did any imaging, sometimes blood work. Finally, one day, I started peeing blood, and she took me to the children's hospital and I was diagnosed with stage 4 kidney cancer. By then, it had spread to both lungs, liver, lymph nodes, and around the heart. I feel terrible for your mother. Obviously, she believed you enough to take you to the ER and doctors multiple times, right? She didn't fully buy what these doctors were saying, and yet they just all told her that nothing was wrong. I would be distraught, man. OP also didn't say how they're currently doing, which is, I don't know if I should be worried or not. It feels a bit worrying, doesn't it? They're probably fine, right? Next story. When I worked in A&E, I had an elderly man come into Miners with his son-in-law. Symptoms were constipation, mild stomach pain, and a bit of abdominal distension. They were just asking for laxatives to relieve his constipation. I examined his abdomen and found a firm central mass, which was a bit unusual. We're taught in medical school to assess for an abdominal aortic aneurysm by putting fingers in a triangle around the belly button, so I did this. As soon as I did, I saw my hands pulsating strongly back at me. Immediately I started crapping my pants. Ordered the man a CT which showed an abdominal aortic aneurysm with an outpouching with an extremely thin wall. This guy was immediately moved from Miners to resus and then straight to surgery. Surgeons say if he sneezed it would have ruptured. Very bad news, by the way. You would lose your entire blood volume in mere minutes. I looked him up afterwards and amazingly, he survived to discharge hospital following surgery, although I don't know how he did long term. It was pretty terrifying for me as you could potentially have mistaken that for a hernia or fecal loading if you didn't examine him properly. But that's my main time I saved a life story. Next story. Neurologist here. A healthy patient came in with a few-month history of left hand numbness. My first thought was carpal tunnel, but physical exam wasn't very convincing. I got CT head scan and found malignant metastatic lesions. Patient and family were talking about expensive designer bags, were very happy, and I had to break the news. They went from seemingly healthy to potentially a few months to live. Sometimes I hate my job. Next story. I'm not a doctor, but I have two. I had a doctor's appointment, just a 6-month checkup for my diabetes. My heart rate was up, so my doctor sent me to the ER for blood work. Turns out I was having a weird version of diabetic ketoacidosis, where my blood sugar wasn't elevated, an ion gap. They kept me in ICU for a week. My mom went to her doctor for shortness of breath. He told her she was old and overweight. We took her to the ER where they drained a couple of liters of fluid off her lungs. Her breast cancer from 5 years earlier had returned, metastasized, and invaded every bone in her body, her lungs and her brain, as well as her lungs and her brain. She died 5 weeks later. Next story. Not a doctor. Annoying, I know. But my mom kept having foot pain. Told her it was plantar fasciitis, wouldn't heal. Then told her it was a fracture, wouldn't heal. Then told her there was a growth. Did a biopsy and it was lung cancer, stage 4. So from foot pain to lung cancer, totally wild. She has also never smoked a day in her life. From foot pain? Like, was that actually related? I don't even know how this happens. The body is a mystery to me, man. Anyway, that is horrific news, obviously. OP didn't say what happened, which is, really annoying, so I can only assume that the mom is in recovery and doing well. Right, guys? Right. Next story. I'm a nurse, so naturally my mother called me one day when she had strange symptoms.
Earlier today, I had this feeling like there was a squirrel running around in my belly.
I reassured her it was probably gas. It happened again a few days later when she was in the car with me. Something made me take her right to the emergency room. The doctor evaluated her and basically accused her of making things up. I asked for a different doctor because she isn't a complainer or a drug seeker. Turns out it was a malignant brain tumor, glioblastoma, and it was manifesting itself as abdominal seizures. They said she had 1 to 2 years to live. It is now 7 since surgery, chemo and radiation, and she is still alive. Next story. Not a doctor, but my husband suddenly lost 15 pounds over a few days. No changes to diet or exercise. I told him it sounds like diabetes and to please go to a doctor. He finally went after a week, and by that time he was skin and bones. It was diabetes, and his blood sugar level was dangerously high. The doc said if we had waited 1 more day, he might have gone into a coma. Next story. Not a doctor, just answering for myself. Also, I don't know if it can be considered a life or death situation. Anyway, had post-concussion syndrome. Already had an MRI done. It was nothing out of the ordinary. Then one day, about a month later, I got up and suddenly fainted. Consulted my doctors and they all agreed it was likely a one-off and I was fine to go travel. But they still thought to be on the safe side I should do another MRI when I returned. I had a few great weeks of traveling that included a lot of outdoors and sports stuff. Then I came back, went for my scan, this time with contrast. By that point I felt like I was wasting time and money. So, imagine my shock when the results came out and I was told, you have a brain tumor. I later found out that people with the type of brain tumor I'm suspected to have tend to have it manifest through seizures. I just happen to have mine in a dead area, so I never had any symptoms at all. I've since had it taken out and we're waiting on the histopathology to get back. Next story. Hubby went to A&D with shoulder ache. He had wrenched it a few days before. They sent him home with codeine and said to go back if it didn't improve. It didn't. So 3 days later we returned. This time they x-rayed and it showed nothing, so they did an ECG. Within seconds they were racing around inserting cannulas, etc. Blue lighted him to another hospital straight into the cath lab where they removed 5 clots from one side of his heart and a massive clot, widowmaker, from the other. Inserted 2 stents. Cardiologist admitted he doesn't know how hubby survived. Said he probably had a minute or 2 to live. 12 years later, he's still here, after surviving another heart attack 4 years later after the first, at Donington Monsters of Rock Festival. One lucky man and one very grateful wife. Look, I'll be honest, I live a pretty sedentary lifestyle for the most part, and I am truly terrified of blood clots, so this is not helping. I swear, this thread is single-handedly going to get me back into running. Next story. This is a story from my mother, who is a sex therapist. She was treating a teenager who basically was self-pleasuring so hard and often, he was rubbing his junk bloody and bleeding through his pants. The kid insisted it wasn't anything sexual. He was just really uncomfortable and his skin hurt. He got hard rubbing the skin. The doctors didn't believe him and sent him to my mother. My mom, devil she was, had a saintly moment and listened to the kid. She suggested he see a dermatologist. Kid had cancer there. Something with an S-cell carcinoma. My mother never saw the patient after their parents called to cancel appointments because they found the cause and he was no longer in need of her services. Next story. As a resident, I had someone come to clinic to resume routine care for routine screenings after an older sibling had passed. Reason for visit was, I want to take better care of my health. I noticed they had a little bit of blood on their napkin and asked to examine their mouth, a few missing teeth, and a massive mass on their gums. Immediately sent them to ENT, where they learned it was oral cancer. They'd eventually get the whole enchilada of mandibulectomy, jaw resection, glossectomy, tongue removal, and I think even neck dissection and laryngectomy. I followed them peripherally on a consulting service until they ultimately passed away in the hospital about a year later. The cruel irony of the whole thing is even worse when I wonder if he would have had better quality of life if I'd never bothered looking and it had just taken its natural course. Just more reason to avoid tobacco and alcohol. 80% of oral cancer is attributable to their consumption, and to eat plants. Okay, so once again, not exactly a mild symptom. A massive mass on gums seems like a big issue. Also, very unrelated to the story, but it was really hard to get through all of those medical procedure names. I have no doubt that the comments of this one are just going to be calling me stupid for everything I pronounce wrong. And feel free to, you have my express permission. Next story. Patient presented at the ER complaining of back pain. They gave him prescription strength ibuprofen and sent him home. His back pain became excruciating and he ended up being life-flighted to our hospital with a dissecting abdominal aneurysm. Poor guy was on ECMO for days before he passed. Next story. 26-year-old seemingly healthy male came to my office, eye doctor, with complaints of mild blurry vision, usually a very routine complaint and easy to fix with glasses and contacts. After a few minutes of trying to get him see better with the refracting lenses, I wasn't able to improve his vision. It shouldn't take that long for someone that young. I decided to quit trying and quickly looked in the back of his eyes. Hemorrhages everywhere, swollen optic nerves. He ended up having malignant hypertension causing his retina to swell. His blood pressure was 270 over 170 in office, which could have made him have a stroke at any minute. We physically drove him to the ER where he was admitted. Next story. Wasn't life-threatening, but I fell and got a few stitches in my knee as a teen. The hospital wasn't the best, and I wasn't even fully numb when they stitched me. I was screaming in pain from the needle and sutures, and 2 nurses were holding me down as they finished. However, the first week or two, I noticed I couldn't walk right. My knee obviously couldn't bend due to the stitches, so I didn't think much of it. When they finally came out, I still couldn't bend my knee, but I figured it was just weak and stiff from being straight for 2 weeks. It still hurt a lot over the following week, and I found I was literally dragging my leg behind me as I still couldn't bend it. My dad was the type of, "Put some dirt in it, son, don't be a baby." And he's the one who took me to the doctor on why I'm dragging my leg like a sack of potatoes. Doctor took one look at it and exclaimed, "I need to go to the hospital right away." Even threatened that if I didn't, they would have to cut my leg off. To be honest, I think she was embellishing, but the scary part, not by much. This hospital was really good compared to the one I initially got the stitches at. Turned out I had an infection in the knee that needed several days of IV antibiotics. They did proper scans of my knee and found I not only blew my patellar tendon, primarily why I couldn't bend my knee, I also mildly fractured the bone itself, which apparently was impressive. Next story. I was the patient. We had gone to India for a wedding, absolutely incredible, and naturally our North American digestive tracts, everyone suffered from deli belly. I was hit harder than most. Almost didn't get on our flight home because I was worried about having to use the bathroom if the seatbelt sign was on or if there was a lineup. Ultimately got home. Everyone in the group, about 12 people, was feeling better, but I was still having some minor gastro issues. Nothing crazy, still working and living normal life. Went to a walk-in because my family doc couldn't see me for at least 2 weeks. Walk-in doc ordered some tests and prescribed an antibiotic. I got a call. The test came back negative, but if I was still feeling unwell, to come back. This was like 2 weeks after my first visit. I debated, but decided to go back. Turns out they never ran the E. coli test, so they run that again. Doc said she'll call me when the results were in. I didn't hear back, but my now mother-in-law, a doctor, caught wind I was still dealing with gastro issues and asked if she could call the lab to get my results. I said, sure, that'd be great. In the meantime, a friend is visiting from out of town and I wanted to show her a good time, so we went out dancing. At some point in the evening, my now mother-in-law had called me something like 17 times, leaving voicemails and texts to get to the hospital ASAP. Don't go home to change. Don't get public transit because cab will be faster. Go straight to the hospital. The nurses were floored the E. coli hadn't gotten into my bloodstream. This was about a month after our trip. Apparently, my urine test came back absolutely overrun with an antibiotic-resistant E. coli. Best part is, the walk-in doc finally called me about a week after my hospital visit telling me she has the results and I should come see her. My mother-in-law happened to be standing beside me when I received the call and asked to speak to the doctor. doctor. As a teacher at the university here, the walk-in doc knew who she was and had to walk my mother-in-law through my case to identify all the ways she let me down as a patient, including asking me to come into the clinic instead of rushing to the hospital. I'm totally fine now and remain forever grateful to my now mother-in-law. So, did this have any impact on you deciding to marry your partner, OP? Because I feel like, of all the reasons to, tie the knot, your future mother-in-law saving your life, pretty high on the list. Glad that all worked out, though. Huge shout out to your mother-in-law. Absolute hero. Next story. I did, among my other jobs, administrative physical exams for my employer for decades. This happened over 2 decades ago. Patients had a chest x-ray and some basic labs before they were seen. I got an x-ray report that said the patient's mediastinum appeared a bit wide, and I should consider a CT scan to evaluate for an aneurysm of the aorta. Whoops. I called the patient, whom I'd never seen. He was not having any chest pain and felt like his usual self, but he agreed to have the chest CT done. For whatever reason, radiology didn't do a full chest CT as I ordered, but they did one limited to the aortic arch and below. The aorta and the mediastinum were normal, but the CT report mentioned some minor stranding extending from the left hilum of the lung extending towards the left upper lobe, which wasn't shown on the CT because they did a limited exam. Okay, I called the patient back, whom I still had never seen, and told him what the CT scan showed. Upon questioning, he said he had some minor pain in his left scapular area behind the shoulder a year before, and he had seen a clinic at a different hospital which had done a series of x-rays and, quote, nothing was wrong. The upper back/shoulder pain had not really changed over the intervening year, and he had grown used to it. The vicissitudes of aging. So I reordered a chest CT and asked radiology to do it as ordered, which, a few days later, they did. Double oops. The full CT scan showed a Pancreatic tumor at the apex/top of the left lung that had extended into the chest wall and destroyed segments of several posterior ribs, which explained the pain the patient was having. This is a very bad thing. I called the patient back again. His appointment to see me was not for several weeks and he needed to know. He took the very bad news surprisingly well, got copies of the CT scan, and went to a local cancer hospital for further evaluation and treatment. I never actually saw him. Next story. My son, 6 weeks old. He was also 6 weeks premature. Only symptoms at the time of me bringing him to the ER were inconsolable crying and he wouldn't drink his breast milk. Was told by others I was just being a paranoid first-time mom. He probably has gas or was colic. My instincts just told me otherwise. Brought him to the ER. Triage asks me what my concerns are. I told them he wouldn't stop crying and I can't get him to eat. A couple hours later, my 6-week-old baby coded blue and went into respiratory failure. Code blue pediatrics will forever be the most haunting thing I've ever heard. Since he was so tiny, they were having incredible difficulty intubating him, was being kept alive in between attempts with that bag thingy, unsure of what it's called, and compressions. His diagnosis was late-onset Group B strep, sepsis, and bacterial meningitis. Had I not brought him in when I did and waited, my son wouldn't be alive today. So, yeah, listen to your instincts. You have them for a reason. Next story. Not a doctor. I work in the CAT scan department. Had a patient who came to the ER because she thought she was pregnant and wanted a test. Happens so often. I don't know why they just don't get a test at CVS. Pregnancy test was negative and they sent her to me for a scan. Patient tells me she was having symptoms from her last pregnancy. Turns out she was having right-sided heart failure, actually. Next story. Obligatory, not a doctor. Had a 38-week pregnant woman with twins come in with a primary complaint of shortness of breath with exertion. She was 4'10". I'm thinking, of course you're short of breath, as short as you are with term twins. I was pretty sure we'd do an NST and send her home. Her blood pressure was 170/110, so we did blood work, and she was in HELLP syndrome. Platelets were 42,000. We were lucky she came in when she did. Next story. 8-year-old girl gets brought in complaining about back pain she'd had for 3 months. Several different doctors had given her painkillers to no avail. After about 5 minutes, I ask her if she's had any problems going to the toilet. She says it's foamy when she pees. Bone cancer. She made a full recovery and from what I know is in her 20s now. But to this day I hate how she'd been suffering for 3 months and no other doctor had bothered to even ask more questions as to why an 8-year-old girl was getting severe back pain. That's insane. There has to be a medical suit in there somewhere, right? An 8-year-old girl with back pain should be cause for concern, especially if it goes on for 3 months, man. OP, I'm glad she came to you when she did. Who knows what would have happened if she didn't. Next story. My husband was a pathologist ghost's assistant for 30 years and did autopsies. Guy goes to the ER feeling unwell. A couple of tests are performed and he's diagnosed with stress, which means, I don't know, and sent home. ER shift change. Quiet time in the ER and a bored doctor reviews cases from earlier in the day. She sees something she doesn't like in this guy's test results and sends an ambulance to the guy's house to bring him back, dead on the floor inside the door. Poor guy ends up on my husband's table, and the hospital gets sued. Where do you live where ERs have quiet times? Maybe this is the disadvantage of being Canadian, but our ERs are always full. The waits can be so unbelievably long. Like, you go to the ER, and if it's not what they deem super serious, I don't know, you might be there for like anywhere from between 8 and 16 hours. Anyway, it was lucky the doctor ended up looking back at stuff, but not too lucky on the timing. Next story. Not a doctor, but I had a massive headache, fainting, and extreme light sensitivity. Doc came and said it was sinusitis. I struggled on, saw another doc at the same practice who confirmed sinusitis. Started slowly recovering but had extreme vertigo. Got a second opinion, confirmed sinusitis. Went private, was in the UK, and was seen by a very dismissive doctor. I insisted on further tests and he reluctantly ordered an MRI. Turns out I had meningitis. Next story. Not a doctor, but I had a migrating headache, kept moving from base of skull to top for over a week. Non-stop, just kept on there. I ignored it and chalked it off to being in front of a computer all day. Started getting a pain behind my right eye. Still thought it was the computer. Everyone kept telling me I should probably go to the hospital. I kept saying no because I don't want to deal with waiting in the ER, all for them to say I need to sleep more. Well, I went and they took me back thinking I had bacterial meningitis. Got a horrible spinal tap and came back negative. The only conclusion was my immune system was attacking itself, and that if I had waited any longer than the week I already did, my immune system wouldn't have responded to any medication and just ended me thinking I was sick. Fun times. Next story. Paramedic, not a doctor. A woman called 911 requesting an ambulance. When I and my brand new rookie EMT got there, she complained of just not feeling well and having a mild headache. I did my assessment and everything looked perfectly normal, except it seemed she might have a cold with a headache. I didn't think she needed to be seen in an ER and told her so. She wavered back and forth and then finally agreed to sign a refusal. I sent my rookie partner out to get the clipboard, but he pulled me aside, told me he thought she needed to go. I asked him why. The best he could do was, I just have a feeling. So I finally relented and told him, fine, you're patient. I'm driving. A few blocks down the road, he leaned up front and asked me to make it hot. Lights and sirens. I rolled my eyes, but did what he asked. At ED, the grumpy triage nurse came up to me a few minutes later and wanted to know why the hell we transported a perfectly healthy woman with a cold and headache. I just nodded toward my partner and said, you'll have to ask him. Anyway, we left, but a few hours later, we were at the same ED, and that same nurse came up to me and told me the news. Because of the headache, the doc had ordered a CT scan. Lo and behold, there was a dissecting aneurysm right next to her brainstem. She had been shipped out to the trauma center by helicopter and was undergoing emergency surgery. I learned later she survived without deficits. Holy crap. If I'd had a more experienced partner that day, she would have ended up dead and it would have been my fault. OP, props to you for swallowing your pride and seniority and letting the newbie have a voice. Now, they didn't really have a clear reason why they wanted what they wanted, but their hunch was right, and some people really do just have instincts for this. I truly believe that. But seriously, it would have been so easy to say, no, I'm the senior here, absolutely not. She's just sick, that's all. Instead, you said, okay, sure, man, but it's your job, which is fair enough. Anyway, good work, OP, and great work, OP's partner that day. Next story. I thought I pulled a calf muscle. I did the whole RICE protocol, but nothing helped. I was limping because of the pain. I ended up going to urgent care, which was a waste of time because it could be a blood clot, so they sent me to the ER. The ER did an ultrasound of my leg and found nothing, so they gave me muscle relaxers and sent me home. They noted I should follow up with my PCP, though, because my blood pressure was really high. I chalked it up to the anxiety of being evaluated for a blood clot. A few days later, I developed this little cough and an intermittent sharp pain between my shoulder blades on deep inhales. Being that this was September 2020, I thought this was for sure COVID. But I also then remembered that I needed to follow up with my PCP about the blood pressure thing, so I called to talk about both items at once. The nurse was alarmed and told me, in no uncertain terms, to go straight to the ER to be evaluated for a pulmonary embolism. And that's how I found out I had multiple bilateral pulmonary embolisms. Next story. My husband went in for a routine checkup. His blood work was fine, everything was fine. The only thing was him saying that he was just a little more tired than usual. His doc noticed that he was due for a colonoscopy and set one up for him. The doctor who did the colonoscopy said everything looks good, but he just felt there was something up. So my husband went back to his regular doctor and she did a complete look at him. Blood work showed a very slight increase of white blood cells, so she decided, what the hell, let's do an abdominal scan just to do a look-see, since the colonoscopy doctor didn't feel quite right about things, even though there was nothing showing. Apparently, his appendix was inflamed and surgery was scheduled to take it out. Upon removal, not only was it inflamed, but infected and cancerous as well. Turns out that A, it was confined at that time to the appendix, B, it was a particularly nasty little cancer that likes to spread, C, the cancer was at the far part of the appendix, so when they removed the appendix, the margins were clear, D, it led to the discovery of him actually having a genetic issue called Lynch syndrome, which they were able to figure out was through the maternal line. Turns out that his mom's uterine cancers, his uncle's death of colon cancer, and his grandmother's various cancer issues were all related to this genetic abnormality. If he hadn't gone in for his checkup and procrastinated, his appendix would have gotten worse, and the cancer would have spread. There's a good chance the cancer would have gotten into his intestines and ended up with intestinal cancer of some sort if they hadn't gotten it. He is still very susceptible to getting cancers because of this genetic condition. He found out early enough to be able to be proactive enough for care and prevention. It's been almost 10 years since diagnosis and he's been healthy as a horse ever since. He gets a colonoscopy every year because of it, but that is a small price to pay. Next story. Veterinarian, not MD. During my internship, a woman came in with her 6-year-old Labrador around 1 a.m. Lab lady.
My dog needs an ultrasound.
Oh? What are you seeing that you're concerned about?
She left the house to go out on the porch this evening, and then she just laid down.
Is she eating and drinking okay? Any other issues?
Everything else is fine, but something is wrong with her.
Well, how about we start with some x-rays? X-rays are taken. There's a very obvious splenic mass. Ma'am, your dog needs an ultrasound. Long story short, it was lymphoma in the spleen. They did everything they could and bought her another 10 months or so. Very good dog and very devoted owner. Next story. Not a doctor, but my dad went to his doctor because of a stuffy nose that had been going on for weeks. Doc looks into his nose and noted a deviated septum, said, that's not right, and sent him for tests. My dad had a brain tumor the size of a grapefruit with no symptoms other than a plugged up nose. So he went in with a cold and came out with cancer. Next story. Not a doctor. We had to gently tell a coworker that she needed a morning shower and or deodorant. She went to the doctor to get it checked out and it turns out she had a severely prolapsed uterus and it was infected. We felt terrible telling her she had BO, but thankfully, she got a very serious situation checked out. Next story. I was the patient in this one. My kid was 2 and had a bad cold. Nothing crazy, just a bit wheezy, a croup-sounding cough, and sleeping a ton. My mother-in-law was babysitting him and called me at work to get my opinion on how to treat him. I figured he was fine, but she was worried, so she called the nurse line. The nurse said he was likely fine, but we should bring him in just to be safe. So I went home and brought him to the hospital. We were talking the entire drive to the hospital. He was acting like a typical preschooler with a cold. It was just his breathing that sounded a little weird. I actually apologized to the nurse when we got into triage because I thought we were wasting her time. She took one look at his breathing, told me to follow her, and speed walked us to a back room. Yeah, he was having a major asthma attack and his oxygen was in the low 70s. My mother-in-law likely prevented a way worse outcome by being a worrywart. He had asthma attacks every time he had a cold until he was like 5 and grew out of them. It was terrifying. Next story. Went to ER for a headache I'd had for 2 weeks. Doc wanted to give me allergy meds and send me home. My GP had told me to demand a CT with contrast. Subdural hematoma. Had emergency surgery a few hours later and spent 8 days in ICU with a drain tube in my skull. Women often aren't taken seriously regarding pain. You are your own best advocate. Next story. I've had a couple patients come in and complain about usually mild vision issues like floaters or blurry spots. But after questioning them, it starts sounding worse and worse. But one lady came in and fit the stereotypical Karen template. She was rude, demanded to be seen on a Saturday that was already fully booked. I told the staff that she could wait and I would get to her as soon as possible. It took me almost 2 hours to get to her. She complained of a spot in her vision, usually a floater and usually harmless. But I looked in her eyes and I saw bleeding just off the optic nerve. I asked about headaches and she confirmed. I told her she had to go to the ER immediately, and if she felt off to drive, I would call an ambulance. She looked at me like I was crazy. I eventually convinced her she had to go right now and get checked out, as she was at risk for a stroke or aneurysm. The next day, the ER called and asked if I'd be coming in to see her for the rounds. I was surprised and said, I don't have any hospital privileges, I'm just an optometrist. Turns out her blood pressure was sky high, and they gave her some medication to lower it. Then her pressure dropped so low that her heart stopped, and they had to shock her back into rhythm. She came back the next year for her annual eye exam and told me I saved her life. The doctors told her she could have keeled over dead any minute. And she still had the gall to be rude as hell to everyone in the office. Next story. During studying in my practical year, emergency room, 70-something-year-old woman, lovely person, one of those candy-giving grandmas with perfectly laid curls and all, complains of a rash. Obviously, they sent in the student because rashes are boring and not really a case for an emergency consult, mostly. So picture me, young and full of excitement about the ability to play doctor in a way. No idea what I'm doing generally. Lots of my knowledge gained from Grey's Anatomy, which is definitely not real-life doctor accurate. Mostly. I go in there and remember a Grey's case from some long ago episode. I take out my pen and mark the area that is affected by the rash. It's rather small, right leg, up just slightly above the ankle. Anyway, I mark it, chatting with the lovely lady. Then proceed to go talk to the real doctor who has finished with his studies and gets to do big people medicine. He doesn't like to concern himself with rashes and such boring stuff, and he also lets me know it. So it takes a few attempts to tell him about that patient. We keep getting interrupted. Obviously, everything is more important than some old lady's rash. And that's true in an emergency room, mostly. So after I present the case, he dismisses me to go give the woman some cream and get her out of here. I still tell him about the Grey's episode where one time one patient had a case of what is called necrotizing fasciitis, just to let him know that I have marked the area. Necrotizing fasciitis, cool word, screwed up disease. It's a bacteria that moves incredibly quickly under your skin and eats anything in its path, to put it simply, gaining them the name of flesh-eating bacteria. Incredibly rare. He laughs it off. I go back to my patient to see that the rash has now moved up above her knee. All of that within the hour or so it took me to get a hold of my supervisor. Turns out rare things are rare, but still real. So here I am. Patient has a necrotizing fasciitis of the leg. Because I marked it, I'm sure. So I tell my supervisor, who's with his supervisor at that time, and they don't believe me. They go in, they see the marked line, and now they believe me. I get to scrub in on her case. We take her leg off close to her hip. It ended up being devastating. Next story. Hospitalist internal medicine physician here. I admitted a middle-aged lady a few years ago who presented with her arms, quote, feeling weird. She denied pain or numbness, just noted an unusual sensation she couldn't really describe. Her initial testing in the ER was normal, and she was admitted to rule out cardiac cause of symptoms despite having no real cardiovascular risk factors. When I first looked at her chart, my first thought was, good grief, why did this lady need to be admitted? She had a stress test which was interpreted as equivocal. The cardiologist decided to do a left heart catheterization, angiogram, which to me seemed unnecessarily aggressive. To my surprise, it showed critical 99% blockage in her left main coronary artery, the widowmaker, as well as severe stenosis in several of her other coronary arteries. She ended up being transferred for emergency coronary artery bypass surgery. I definitely am more cognizant now of a more atypical presentation of coronary artery disease, particularly in women. Next story. Patient came in after seeing their PCP for a cough. Just wanted some cough medicine so he could go to work. PCP thought the cough sounded a bit too wet and sent him to the ED for a CXR to make sure it wasn't pneumonia. On arrival, low-grade fever, just barely tachycardic. Laughing, joking, looks great. Over the next couple of hours, just gets worse and worse. Goes septic, then DIC, then unstable, then coded on 3 pressors. Could watch his heart go from sinus tachy to junctional to 3rd-degree heart block and code. Was the most surreal thing. Klebsiella pneumonia bacteremia with terrible pneumonia. Next story. My mom's story. Patient arrived at the emergency room walking from her home with a hatchet in the back of her head. Her husband tried to end her, and she knew he'd hit her on the head. She didn't know it was the hatchet embedded in the back of her skull, obviously in shock. She lived and her husband went to jail, so that's good. Edit. She went to the hospital with what she thought was a bad headache because he'd hit her. She just said her head hurt. Yeah, girl. Yeah, your head would hurt, I guess. She wasn't wrong, just not quite specific enough, I would say. Next story. EMT on an ambulance. Had a patient present with right-sided rib pain of 3 days duration, pain upon palpitation and movement, no other chest pain or shortness of breath, and he wanted to get it checked out. Take him to the local ER and think nothing of it. Walk through 20 minutes later for paperwork and he had gone into full cardiac arrest and CPR was in progress. Ended up living, thankfully. Next story. I had a coworker go to the doctor for some skin problems he was having. I don't know exactly what it was, but the doctor told him to leave and go immediately to the hospital. When they saw him, they prepped him for surgery and he woke up with a huge chunk of skin taken out of his back. Next story. I was the patient. At 36, I hit my tonsils out. I developed an infection and my stitches split and I started bleeding in the back of my throat. The blood was shooting straight down my throat. It felt like Pop Rocks. My wife has the neighbor come over to watch the kids and we go to the nearest ER. I go in and my wife parks the car. I go to the front desk and say, my throat is bleeding. They have me sit down and fill out paperwork. My wife comes in and goes full Karen. I get sent to the back and immediately vomit semi-coagulated blood all over. I then look at the nurse, tell her I'm cold, and pass out. I wake up in a hospital room. I had emergency surgery and they estimated I was down over 2 to 2.5 pints of blood. Apparently a nurse in the ER saw me throw up the blood and she threw up as well. OP, do not tell me you were ready to sit down and do paperwork. If you are bleeding straight down your throat, do not do that. Say, hey, I think this is urgent. Come on, man. Next story. 1 month ago, my husband had his blood checked for low testosterone, prostate cancer survivor. That night we were in the ER and he was diagnosed with stage 4 pancreatic cancer. Spots on the liver. No cure. He had his blood checked late June and nothing. No symptoms except for being more tired than usual. Please go to the doctor regularly and get checked out. This couldn't be helped, but many things can. Next story. As a student, we saw a patient who had come in with numbness in his inner thigh/saddle region. He was also so excited that he'd lost 30 pounds in the past couple of months. I saw his scans, but kept quiet. It wasn't my place as a student to tell him he had brain cancer. Next story. Patient came in with 2 to 3 weeks of SOBOE. She was 65 and had seen her GP, who gave her an inhaler. Came into me and on her routing ECG had classic findings for a PE, clot in the lungs. She had a massive saddle PE. She was so well though, sitting up in bed, laughing and joking with me. She wasn't even requiring oxygen and all her vital signs were normal. When I told her the diagnosis, she broke down from relief and cried her eyes out. She was inconsolable and kept saying that she thought she was going to die. Something about it didn't sit right with me, and I told the other doctor who was on call for the evening to watch her. I had a feeling she was going to arrest. Got a text from him the next morning that she arrested and died overnight. Went from being perfectly fine in the hospital bed to feeling a bit anxious to straight up just dying. Crazy. Next story. Not a doctor, but a nurse. Was triaging in A&D and a man presented to the front desk complaining of shoulder bruising after a fall. Receptionists are not there to triage. They just take the patient's description and write it down. We call those patients in for triage and then look at the priority for treatment. We called him through and he starts casually telling us how he's a mountain biker, came off his bike and landed on his shoulders. Landed on his shoulders, falling head first. Landed on his shoulders, falling head first, off a small edge. He pulls his t-shirt over his head to reveal very extensive bruising around his arms, shoulders, back, and neck. He fell off his bike over a ledge, down an 8-foot drop, and landed on his head. It was at this point that we both, myself and the nurse with me, sprung into action, gently lowering him down onto the trolley, placing blocks either side of his head and while explaining to him our concerns, taping him down. He then complained that he had some neck pain. We wheeled him to the x-ray down the corridor. He fractured 2 vertebrae in his neck and broke his shoulder. As far as I know, he recovered. He certainly could have been far more unlucky and ended up with life-limiting damage. Next story. During COVID, I went to the ER with chest pains. They said no heart issues and no blood clots, so go home and discuss with my GP. Turns out I'm supremely allergic to shrimp and was having esophageal spasms. I figured it out after realizing that the yellow curry powder in my meal kits was giving me similar issues. Yellow Thai curry powder often has ground up shrimp as an ingredient. I didn't actually know that about curry powder. I don't know. I've had yellow curry a lot. Never did I guess that it would have had shrimp as an ingredient. Good to know in case I ever have a friend with shellfish allergies or something that wants it. Next story. Patient, not doctor here. Age 28. I went to the neurologist for the occasional migraine. They listened to my heart and said, "There's a very slight murmur, but it's probably nothing. It's still worth getting checked out just in case though." I had an echocardiogram. I had a hole in my heart and a leaking valve. I would have dropped dead in middle age had I not gotten open heart surgery to fix it. The annoying thing is, had I dropped dead now, anti-vaxxers would blame the COVID vaccine. Next story. I'm not a doctor, but my husband was the patient. On our way home from vacation, he had the worst diarrhea and vomiting. Poor dude barely let me stop the car before he tumbled out and emptied both ends on the side of the highway. He hasn't stopped praising me for keeping a roll of TP in the car for emergencies since. I get him back in the car and find the nearest hospital in rural Mississippi. They get him medicated and hydrated, and he's trying to walk out of there because he feels fine. But every time a nurse takes his blood pressure, another medical professional hurries into the room. He started with an NP and graduated to an infectious disease specialist before the end. They keep testing it with different cuffs, on the other arm, all kinds of things. And then they get him a chest x-ray and order a CT scan. But he gets up and wanders away from the CT room to go take a bathroom break. He was walking around under his own power with a blood pressure reading of, "Why are you conscious?" They get him back from the scan and then admit him to the ICU. He was feeling okay by that point, but he was also dying of sepsis. He got the reward for the most alert patient in the ICU, and I got to call both our bosses to extend our vacation while we waited for the massive dose of antibiotics to fix the problem and verify that if it was C. diff or not. It was not. I can't imagine how frustrating it would be to be a medical professional, watching someone who you're like, you should be in bed, like unconscious, and they're just walking around, getting water, going to the bathroom, and you're like, how is this possible? Everything I've learned says this shouldn't be possible. How are you doing this? Although maybe they're also like, oh, this is cool as hell. But I don't know, I feel like I would be a little miffed for some reason. Next story. I had a gastric bypass 8 years ago. After about 2 years, I started gaining weight and was constantly feeling unwell. Surgeon who did the bypass told me it was in my head and nothing was wrong, even told my GP, etc. So I was blown off until I was admitted to hospital with severe anemia, gallbladder pain, and elevated liver sats. Turned out he had messed the bypass surgery up in a spectacular way. I'm currently waiting to have a hole in my diaphragm repaired, my pouch resectioned as there's a hole between my pouch and old tummy because he made the pipe from my tummy to intestine too short by 2/3, and they think he has joined to my bowel in error. The surgeon I have now is going to try to start fixing the mess, but he is warned I'm in for multiple operations and a whole world of pain, and was horrified when I checked with him it wasn't all in my head. Sad thing is, the original surgeon is still allowed to operate on others. I'm the third person I know of who he's messed up. Sorry, you're the third person he's messed up? One mistake, I'm like, sure, off day, whatever. Very bad in a medical field, to be clear. But, I mean, it happens, I guess. Still probably a medical malpractice suit or something, I don't know. But three people he's messed up. That's just ignorance. He just doesn't know. He's just bad at his job. Do not let this man operate, please. Next story. I'm a doctor up in Canada. Been in practice close to a decade. Seen all kinds of crazy things and have crazy things happen to my loved ones. Here goes. When I was still in training almost a decade ago, my mother had minor vague muscle and joint pain for months. We all thought it was muscle related from all the housework/work that she did. She went and saw her family doctor who ordered imaging. It basically came back all normal. In effect, nothing acutely wrong. The radiologist did make a comment about a sclerotic lesion on her hip that needs to be monitored. The differential was wide, but he did mention that it could be metastatic cancer. But the possibility was very small. He did ask for ongoing monitoring, though. My mother showed me the report. I even underlined the part about the possible metastatic cancer and told her she needs to follow up with her family doctor. She did see the family doctor within the week. The family doc said it was nothing and she's fine. Fast forward a few months and the pain never went away. She went to a walk-in clinic next with the same pain complaint. She was discharged home with some anti-inflammatory pain meds. Again, this was a mild, vague pain and her functional abilities were not affected at all by this point. This was a perfectly healthy woman in her 50s, never smoked a day in her life, did no drugs, ate well, exercised, and did yoga. She was never sick. She felt well enough to go on a month-long vacation overseas, but while overseas, the pain became worse and worse. It got so bad that she had to go to an overseas hospital. They completed CT and all kinds of imaging. It turned out to be stage 4. Metastatic lung cancer. She never smoked a day in her life. After battling this cancer for 8 months, she passed. I went on the warpath after this happened. It turned out the sclerotic lesion picked up on the x-ray was already an indication of metastatic cancer, source unknown at the time. The family doctor didn't bother looking any further. I unfortunately trusted her family doctor too much, as this was the only doctor of our lives. After this happened to my mother, I was ever vigilant of picking up things like this. Luckily for my career, as a result of my vigilance and the pain I went through, I ended up picking up all kinds of cancers simply by reviewing the radiology reports and doing exactly what the radiologist suggests. The radiologist often makes recommendations on repeat imaging after a certain amount of time. I'm surprised how many doctors simply don't follow up on that, as simply doing a repeat imaging in a set time can catch a lot of cancers. Another 2 examples I can recall. Also early in my career, in my first year of practice, this man came in for vague symptoms like fatigue and just feeling something wasn't right. He wasn't able to pinpoint exactly what the problem was, and he also never verbalized that he had any kind of neurological symptoms or even a headache. I did all kinds of blood work, bodily imaging, but didn't scan his head. Luckily for me, there was this much older doctor at the end of their career in the office who simply wanted to see a few patients a day to pass the time. She ordered a head CT and found that this man had brain cancer. I didn't follow the case after that, but I wouldn't be surprised if this man passed on fairly quickly. During COVID times, I was doing all kinds of telephone medicine gigs. This one case stands out and is very similar to ones I've experienced before. Patient calls me about diffuse bodily pain, literally everywhere. She had already gone to several walk-in clinics and was discharged home with pain meds, as the docs thought it was musculoskeletal. Well, knowing what I know and what I went through, I ordered a bunch of imaging, x-rays, ultrasounds, to actually look inside her body. Apparently none of the other walk-in docs bothered to do this. Unluckily for her, it turned out to be some kind of metastatic late-stage cancer, source unknown. The cancer was everywhere, thereby causing the pain. She died a few weeks later. I've never even met her in person. All this was done over the phone. The family was grateful and actually called the clinic to thank me personally for ordering these imagings when no one else had bothered to. The family said she died fairly quickly after the imaging was done. They didn't even have time to figure out the source of the cancer. Speaking of sclerotic lesions, I have a patient right now with this that I just picked up on imaging. I'm in the process of calling them in and doing a full cancer workup. The uncanny thing is that the description of this lesion was exactly the same as the time it was used to describe my mother's lesion. I've developed a reputation as a cancer whisperer of sorts in my circle of doctors. The point is, don't be afraid to ask for basic imaging if you're experiencing unexplained pain lasting for a fairly long period of time. Cancers are much more common than you might think. Holy, a response from an actual doctor, and it's a big one. OP seems to have a lot of experience with this. It's definitely scary how benign these symptoms can seem, and then all of a sudden, they actually end up just being, lung cancer in their mother's case. To be fair, I don't know if a sclerotic lesion is a mild symptom. To be fair, I don't really know what it is at all. But clearly, the doctor wasn't too worried about it. But it's great that OP is using that life experience and being like, no, I'm a doctor now and I am going to do things differently. I am not letting this happen to anyone else's loved ones, which is incredibly heroic in a way. So OP, keep fighting the good fight. You're doing great work out there. Next story, my mom. She had somewhat of a mild cough and was way too tired, so she went to the local doctor. He told her that it's just a cough and advised her to take something for 3 days. She went again. This time he advised antibiotics for 5 days. It didn't help. Every time my mom asked him to refer her to some other doctor or run some tests. Both can't be done without the doctor's reference. He refused. So after around 2 weeks, she went again to see the same doctor and he was on leave and she almost collapsed. My dad took her to another doctor on emergency finally referred her to some better hospital, and there they found she has liters of fluid in her lungs. They again referred her to some specialist. After moving again, we found out she had cancer. She died after 6 months of the first collapse. Next story. Not a doctor. Thought my Crohn's disease wasn't doing too well. Asked my gastro office to order blood tests. They requested I stop by radiology too. Worked a full day, drove myself to the hospital for quick tests, even dropped off my daughter at an appointment. Came home. Potassium at critical levels. A call came from gastro's office just as I got in my jammies. Do not pass go, do not collect the $200, proceed directly to the ER. I'd already had a heart attack 3 days prior, we think. Had to be hooked to heart monitors while they tried to pour K into my arms, as I couldn't digest much of anything. Spent 9 days in the hospital trying to get K and magnesium back to safe levels. Next story. Honestly, a lot of people with COVID-19. Folks were told over and over again it's just a cold, it's not that serious. And then when they were really sick, they thought, oh, maybe they just needed some antibiotics or something. I intubated tons of people who couldn't believe that COVID-19 was ending them. Next story. Was helping to move a bed down a flight of stairs. It was one of those heavy adjustable beds. Needless to say, I was pretty winded when we were done. Didn't think much of it. I had a doctor's appointment the next morning. She asked about shortness of breath as a routine question, and on a lark, I told her about moving the bed. She mentioned it's possible I should get my heart checked out. Go to the ER at my earliest convenience. Later that day, I noticed my back hurt. Felt like I slept wrong. No big deal. Went to an optometry appointment, got new prescription. Normal day, right? Suddenly got very nauseous while picking out frames. Threw up in the bathroom. It felt a little better, so I finished what I was doing. When we were all done, I remembered my doctor telling me to go to the ER to get it checked out, and I was feeling a little off from the vomiting. Went to the hospital and the guy asks, "What are you here for?" I responded lightheartedly that my doctor said I should probably get my heart checked. He hooked me up to a portable heart monitor thingy, and then crap got real rushed real fast. Next thing I know, he's got a needle in my arm pumping in morphine. It was then that I learned I'm allergic to morphine. Good times. I remember asking him if my veins were supposed to turn bright red and itch like that. Next thing I remember was waking up in a hospital room completely alone. Turns out I had had a massive heart attack with one of my valves 100% blocked. They added 3 stents into various places, but the fluid was so backed up that when they opened up the valve, it flushed into my lungs, filling them with liquid. This is how they explained it to me. I spent the next week in bed bored out of my mind, just waiting for the various diuretics to drain the fluid from my lungs. Turns out if I hadn't gone to the ER, I'd likely been dead within the hour. All from minor back pain and some nausea. Next story. The last patient I saw on ED rotation was a mid to late 50s guy brought in by family because he'd been unwell for months. He'd seen a family medicine doctor whose notes said not a whole lot more than, "This guy is definitely depressed," and who tossed some Celexa at him with a monthly follow-up. The guy looked pretty worn out and talked about feeling kind of down and tired, sleeping all the time, having loss of appetite and weight, and feeling guilty he wasn't keeping up with life, which made sense because he had pancreatic cancer. Next story. I'm a doctor. Patient came into emergency room outrageously drunk, brought in by his friends who didn't know what else to do with him. Young guy. While I was seeing him, he lost control of his bowels. At first, I put it down to the booze, but as I was writing my notes, I started thinking, how many times have I crapped myself all drunk? Decided to scan his head. Large tumor in his brain that required some pretty urgent surgery. Unfortunately, not sure how he's doing now. Moral of the story, even if you're wasted, crapping yourself, not a normal response. So what you're saying is that if this guy is still alive and doing well, then drinking saved his life. You heard it here first, folks. Drinking is good for you, can save your life. Disclaimer, this is not professional medical advice. Please don't sue the channel. We've already had issues in the past. Next story. Not a doctor. 2 weeks before Christmas last year, my brother went to the ER with a fever. His blood sugar was high and he said he just felt drained for the last month. He said no matter how much he was sleeping, he always felt tired. After doing blood work, they discovered he had almost no platelets or white blood cells. My sister, who's a nurse, said his blood has the consistency of Kool-Aid. He was diagnosed with AML leukemia. I went to see him in the hospital and I didn't think he was going to make it. He was transferred to a hospital that specializes in the disease and he was in the hospital for 2 months. Thankfully, he's now in remission and going back to work soon. Next story. My 40-year-old brother had a wart on his finger that he ignored for 10 years, against my mom's admonishments. Just a wart, he said. One day he's at the doctor's for something totally unrelated, and he's like, "Oh hey, by the way, can you cut this wart off?" And they're just like, "This is rare and aggressive super cancer, and we need to get you into a lung scan immediately. Holy crap, you're literally maybe dying. Let's see if we can even save your hand." From, "Hey, can you cut this wart off?" to complete amputation of his index finger below the bottom knuckle was maybe 3 months. Frigging terrifying. But whenever I tell this story to people who are laissez-faire about getting something checked out, boy, howdy do they scramble to the doctor after that. Next story. Patient. I went in describing that I'd woken up in the middle of the night shivering uncontrollably, then later woken up on the floor with a 500 out of 10 headache and my entire body hurt. Told them this happened every so often, but this was absolutely the worst one. I looked fine, but felt horrible. They told me I was a drug-seeking faker and kicked me out. A few weeks later, the same thing happened at my friend's house, except when I woke up the second time I was in the ER already again. A few weeks later, the same thing happened at my friend's house, except when I woke up the second time I was in the ER already, and when I talked with the doctor there, her jaw kept dropping lower and lower, until she asked me, "How the hell are you not dead yet?" Apparently, I'd been describing the first-person perspective of a seizure. Turns out I'd been living with undiagnosed epilepsy for several years. Well, OP, I guess you really lucked out this never happened when you were driving or something. Holy, you were epileptic for several years and you had no clue? No idea at all. Just thought, that was strange, and went back to sleep, I guess. I'm mad for you that the doctors were so dismissive at first. Like, are you kidding me? At least check the man out, please. Next story. Not a doctor. Had a sinus infection that after it went away, I still felt sick. Ended up going to the ER because my heart rate was 200. Came out with atypical pneumonia. Guess what? I'm still sick 2 years later, and no one takes me seriously, even after countless CT scans and 2 bronchs showing I still have the pneumonia. I know it might not be life or death, but it's affected me immensely for the last 2 years of my life. I'm only 25, and I can't function as a normal 25-year-old like most everyone around me more than half the time because I feel like I have the flu 24/7. Next story. Not a doctor, but a patient. I had a pretty angry uterus that I was working on dealing with, but being a woman without kids means I had to wait a lot. One day I started getting a pain in my abdomen. Slowly got worse throughout the day. Told my sister I'm going to bed. If I wake up in the morning and it's not better, I'll go to the ER. Woke up early the next morning, which was a symptom in itself because I hate getting up early. Went to the ER. They did a scan and gave me pain meds which made the pain go away. They said, "Your pain is gone. You're not an emergent anymore. Follow up with your GP. Oh, and by the way, on your scan, we found a small black spot on your kidney. Make sure you follow up on this." Bam. Kidney cancer. We caught it so early, surgery was curative, and I'm completely fine. I just get a yearly MRI. Also, finally got a hysterectomy. No more abdominal pain. I mean, hey, at least they let you know and told you to check it out. Would have been way worse if they didn't mention it, I guess. But still, I feel like one would hope that they would do a bit more for you than just be like, your pain's gone, and go check this out. But I guess depending on where you are, they have tons of patients to get through probably, so kind of fair enough. Anyway, yay for no more abdominal pain and no cancer. Anyway, that's the last story for today. Thank you so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.